Hello, I'm Stephen Moyer. I'm Chief People Officer for NHS England, and I'm also Head of Profession for Human Resources in the NHS. There are a whole range of tools that we can go about measuring, monitoring and gaining better insight and analysis into staff experience as it happens. The NHS Staff Survey is an annual piece of work that every trust participates in. NHS organisations get really rich and deep feedback into how staff experience their working environment, how they feel about their leaders, their line managers and the way they're communicated with and the way they're treated. But the NHS Staff Survey is only one way we can get really good feedback from staff. The Staff Friends and Family Test is a much more timely and meaningful measure of how people are experiencing their working environment, what they think about their work. And of course that matters a great deal because we're all ultimately taxpayers, but more importantly we're potentially all patients at some point in our lives. So our experience of the NHS's staff is also about creating positive advocacy in communities, getting people to understand the work we do and really celebrate the success of the NHS.
I'm Sheila Jones. I'm the Head of Staff Health and Wellbeing at Tees, Esk and Wear Valley's NHS Foundation Trust. The Staff Friends and Family Test is a form of staff engagement. It's a temperature check to see how staff are feeling. We use Picker as an independent contractor for the Trust, and that helps with the anonymity and helping with the analysis of the data. So Picker email staff with an invitation to participate in the survey. It's very quick, it's online and it takes maximum of 5 minutes to complete.
So the Staff Friends and Family Test is a great and timely way to do that. The NHS Staff Survey is a great and timely way annually to get detailed analysis. But actually, one of the most important ways to get feedback from staff is just to listen to them, have conversations with them and find out what they think about their working environment.
Hi, I'm Rhian Bishop. I'm Staff Engagement Lead at Sheffield Teaching Hospitals Foundation Trust. We've found that using Staff Friends and Family testing has really helped us improve both staff experience and patient experience. My advice for any organisation is if you're actually going to use Staff FFT to drive improvements in this way, you need to get your managers on board because it's the managers, the frontline managers who really can make a difference and can actually use the Staff Friends and Family testing data.
In urology, what we wanted to do was to really drill down to staff and their views. So we used FFT in a way that we split up all the occupational groups. So we split nurses from admin and clerical from medical staff. And we split inpatient nurses from outpatient, so we could really drill down to staff's views. We told staff how important their views were, and then when we got the results, Jill and I met with all the staff at little venues and used really the FFT results as a platform to talk about what the concerns were and anything else that we could do to improve the service. And they were very, very successful events. People used them as an opportunity to talk about all sorts of things that could improve patient care.
And from the feedback we got from the staff, we were able to make some real quick wins that made a difference to the staff at work and patient care.
As a result, the staff engagement score and the FFT score both rose. And more importantly, staff, we felt them really felt engaged in the work, and they came up with other ideas for other suggestions that they wanted to do on the ward. We had a Give It a Go week where we tried different things in our outpatient area, and from there we've really gone from strength to strength. And we hope that this year when we do the FFT test, we'll get an even improved response rate because staff will understand that we do listen to their views and take them on board.
It's really important that managers then use this information that they receive as a basis for further conversations and discussions with staff. And that gives them the opportunity to actually say to staff, you've told us this, what can we all do about it? But what is absolutely key to Staff FFT being a success is that managers must then implement and act quickly on what their staff are telling them.
At one of our staff engagement sessions, we listened to the care support workers, and they're very involved in food and the delivery of food on the wards, and they raised a number of issues around food wastage and the delivery of the meals and the way that the meals are delivered. Different wards were doing different practices. Some was good, some could have been improved. So we shared good practice at the session, and we also involved the catering team, the trust catering team, and we looked at food wastage. As a result of that, we've cut down on a lot of the food wastage, which has saved the trust money, and we're also able to deliver a much more efficient food delivery service.
What we found as a result of these feedback sessions was that in some respects wards hadn't got the appropriate service systems in place to cater for their needs. So, for example, the high dependency units were over-ordering food, when in actual fact, on a lot of occasions, their patients weren't eating. What we've put in place now to accommodate the high dependency units is that every day the catering staff go onto the ward to check how many patients are actually eating, and then they take up the food at the appropriate meal time so that the wards just get exactly what it is they need on a daily basis. What we've done as a result of these feedback sessions and audits is that we've checked that the service is right, that they have the right equipment, that they're doing the right style of service that suits their ward, and that the patient is getting what they need. Therefore, some of the menu options have changed on some of the wards, and the patients are now getting a better choice of meals, and so the uptake of the food is better.
That is one of the advantages of using Staff FFT compared to the staff survey, because we can act on Staff FFT information within a matter of weeks. So it's really important that you break Staff FFT down. We do it by occupational group, but you do need to break it down below a trust or organisational level, so it's relevant to the managers that you're asking to use and work with the information.
NHS England thinks staff experience is really important for a number of reasons. First and foremost, as part of the 5-year forward view for the NHS, the experience, the engagement of staff is fundamentally recognised. Staff well-being is recognised in the 5-year forward view, and we believe that's important to help transform the NHS, provide better quality care closer to home, and to improve prevention of people needing admitted to hospitals. Staff experience is going to be fundamental to the future of the NHS and driving up better levels of care. For NHS England itself, as a commissioner of NHS services, both directly and in partnership with clinical commissioning groups, staff experience forms part of our contracting and commissioning round. It's really important in terms of the longer-term service transformation plans that providers and clinical commissioners are putting in place at the moment. So for us, staff experience is very much at the heart of not only planning for the NHS now, but planning for the NHS of the future and delivering better quality patient care.